Hi, my name is Rosie, and I chose Conversational Recast Training for my therapeutic intervention. Conversational Recast Training is a hybrid technique that uses recasts to increase the correctness and complexity of children's language. Recasts come in a variety of different forms, but the basic idea is that the conversational partner repeats a child's utterance using correct grammatical form and preserves the meaning of the original utterance. If you guys have taken Bob Owen's language development class, then this should be familiar to you. We call the child's utterance the platform utterance. Recasts are only one of the methods that parents naturally use to teach language to children. In conversational recast training, we use this naturalistic technique in a targeted way and expose the child to much higher rates of recasts than they would normally experience in regular conversation. CRT can be used to target any linguistic form, such as sentence modality, grammatical features, phoneme production, and vocabulary, although it is most commonly used to treat grammar. The target population for CRT is any preschool-age child with a speech or language impairment. CRT can also be used with older children who function at a preschool level in terms of language or development. Children with any diagnosis are potential candidates for CRT, although there are some features that make CRT a better fit for certain children. Since CRT requires child utterances to recast, the intervention may be easiest to implement if the child readily engages in dialogue. Also, it is best for children to be above a 2-word level, because if a child's platform utterance has only 1 or 2 words in it, the clinician may have a difficult time understanding their meaning. And as a result, they may create a recast that does not maintain the child's intent. Off-topic recasts will not be therapeutically useful because they will not highlight a correct production of the child's intended meaning. Additionally, one of the operating principles of CRT is that the recast will naturally be attended to by the child because it is a continuation of a conversational topic that the child selected, which means that it will be inherently interesting to the child, and the child will be very likely to attend to it. Poor intelligibility represents the same problem. If the clinician cannot accurately recast the child's statement, there will be no therapeutic value. CRT can be utilized in pretty much any setting. It could be used in the home, in a classroom, in a small group, or in a one-to-one scenario. Parents have been trained to use CRT, although the evidence shows that it is a time-consuming process that yields minimal gains. The first step in starting CRT therapy is to perform assessments that will identify the linguistic forms we wish to target. It's also important to do a language sample. Goals should focus on specific things like increasing the frequency of copulas or third-person S. Once goals have been established, therapy proceeds in a play context. The therapist selects toys that they can use to elicit the targeted linguistic form. When the child produces the targeted form, the clinician recasts the utterance. In some variations of CRT, clinicians model the target form using a play scenario. Alternatively, the clinician may use questions to elicit the desired language from the child. In some CRT techniques, neither of these approaches are used, and the only language that is modeled or recast is the language spontaneously generated by the child. One of the things about conversational recast training is that it's a pretty flexible technique, and it has been used in a lot of different particular ways. In my scenario, I will demonstrate the use of CRT for targeting third-person S. I will start by modeling third-person S with the child. Then I will use 3 types of recasts with the child. First, I will use a corrective recast. When clinicians use corrective recasts, they model a correct version of the child's platform utterance and do not expand on them. Next, I will use a non-corrective recast. Non-corrective recasts do not preserve and correct the form used in the non-corrective recasts do not preserve and correct the form in the platform utterance. Instead, they build on the utterance using the target morpheme. Finally, I will use a tag question recast. There are many different ways platform utterances can be recast as questions. For example, they can be recast as yes-no questions, auxiliary fronted questions, or WH questions.